Namaskar. Today we will study diabetes mellitus. Diabetes mellitus is a metabolic disorder. It is a chronic metabolic disorder involving carbohydrates, proteins, and fats. It is mainly characterized by hyperglycemia. So, hyperglycemia is when we have sugar level higher than normal. So fasting blood sugar becomes more than 7 millimole per liter, and 2 hour post-prandial blood sugar becomes more than 11.1 millimole per liter. Now, the range actually it is 70 to 100 milligram per deciliter. It is the fasting sugar normal range it is said. However, when it is more than 120, or if we consider 7 millimole per liter, it will be more than 126, then we say that the person is suffering from diabetes. So when there will be hyperglycemia, so the hyperglycemia is sugar level or glucose level is more, and but not it is not only restricted to the carbohydrate metabolism. There is also disorder of your protein metabolism and fat metabolism. When there is hyperglycemia, the glucose which is normally reabsorbed in the proximal convoluted tubule of kidney that exceeds the reabsorption limit and appears in the urine. That condition is called glycosuria. Then because of glycosuria there will be again osmosis, more osmosis and more urine, so that is polyuria. And because of more water loss there will be thirst feeling, so that is polydipsia. And there will be abnormal protein metabolism, so that will lead to muscle wasting. There will be elevated levels of circulating lipids, and there will be appearance of ketone bodies like acetoacetate, beta hydroxybutyrate, acetone. So the condition will be ketosis. Then in blood the ketone bodies will be there more, so ketonemia, and they will appear in the urine, so that is ketonuria. So these are all the symptoms associated with diabetes mellitus. So when there is diabetes or hyperglycemia, that occurs because glucose is not entering into the cells and it remains in the blood, and that leads to several complications. We call them diabetes associated complications. The free radicals, the oxygen derived free radicals, protein kinase C, non-enzymic products of glucose and albumin called advanced glycation end products AGE, all of them cause the vascular complications in the large blood vessels as well as in the small blood vessels. So in the large blood vessels we call it as macrovascular complications, in small blood vessels we call it as microvascular complications. So macrovascular complications include the atheroma, and its thrombotic complications that leads to macrovascular diseases. Whereas in small blood vessels we call it as microangiopathy. So the small blood vessels in retina causes retinopathy, in kidney it causes nephropathy, in peripheral nerves it causes neuropathy. So diabetes associated complications include atheroma, retinopathy, nephropathy, neuropathy, and that actually causes harm to the patient. So if you see the carbohydrates are digested to the simple form this glucose, similarly proteins to amino acids and fats to fatty acids. And insulin has a role in all these, and from blood this glucose enters to the cells through glucose transporters. Because glucose is water soluble, it requires a carrier called glucose transporter or GLUT, and insulin helps in synthesis and recruitment of GLUT on the cell membrane so that glucose can enter into the cell. And as you all know, we need glucose as a source of energy. It provides energy through glycolysis followed by Krebs cycle. It provides us ATP, and ATP is the energy. Similarly, these amino acids are uptaken into the muscles, and then they are needed for protein synthesis. That is also helped by insulin. Then in the adipose tissue or fat tissue, lipogenesis, that is conversion of free fatty acids to triglycerides, is done by insulin. Insulin inhibits the lipolysis triglyceride to free fatty acid conversion in adipose tissue, whereas promotes lipogenesis, that is triglyceride synthesis. So insulin has a role, and in blood it stimulates the action of lipoprotein lipase, converts triglycerides to free fatty acids. So insulin has a role in carbohydrate, protein and fat metabolism, and deficiency of insulin is the major cause of diabetes, and accordingly we have different types of diabetes. So type 1 diabetes is insulin dependent diabetes mellitus. Type 2 diabetes mellitus is non-insulin dependent diabetes mellitus. That means when the insulin is deficient, that means the cells which secrete insulin are destroyed, then we call it as insulin dependent diabetes mellitus, because we have to administer insulin. So in this type of diabetes, that is called type 1 diabetes mellitus, the beta cells are destroyed. The beta cells which secrete beta cells of islet of Langerhans of pancreas. Islet of Langerhans of pancreas have 4 types of cells: alpha, beta, delta and F cells. The beta cells secrete insulin, and when these beta cells are selectively destroyed, there will be absolute insulin deficiency, and in that case we have to administer exogenous insulin. So that is called type 1 diabetes mellitus. And when there is relative deficiency of insulin secretion, that means the beta cells of islet of Langerhans of pancreas are there, but they have become non-functional. The insulin release is not sufficient. Sometimes insulin release is there, but insulin resistance is there. There is tissue resistance to insulin action. Insulin is not working. In both these cases, insulin deficiency, which is relative deficiency, as well as insulin resistance, in that case we have to administer drugs which will increase the release of insulin or which will increase the sensitivity of insulin. So they are called insulin sensitizers. In that case, it is not dependent on insulin. We either administer insulin releasers or we use insulin sensitizers, and that type of diabetes is called non-insulin dependent diabetes mellitus. Non-insulin dependent because we don't need insulin to be administered in these patients, and when we need insulin to treat these patients, then that is called type 1 diabetes. And when we give other drugs other than insulin, that is called type 2 diabetes mellitus. There are two other types of diabetes mellitus. There may be some other causes like non-pancreatic causes, or maybe due to any drug therapy. So there may be multiple other causes of diabetes, and those type of diabetes can be included as type 3 diabetes mellitus. And in some women during pregnancy there is uncontrolled sugar, and that is called gestational diabetes due to hormonal changes, and that is called type 4 diabetes mellitus. So this is all about diabetes mellitus. Thank you.